How do pathological fractures happen with osteoporosis? Imagine bones that are supposed to be strong and supportive suddenly becoming fragile and prone to breaking even with little effort. That's what happens in osteoporosis. This disease weakens bones by disrupting the normal process of bone renewal. Normally, old bone is broken down and replaced with new, healthy bone. But in osteoporosis, this balance tips toward excessive bone loss, leading to bones that are less dense and more brittle. This weakening affects both the outer shell of the bone, called cortical bone, and the inner spongy part known as trabecular bone. When these layers become thin and porous, bones lose their ability to absorb shocks and distribute forces evenly. In healthy bones, the structure is like a sturdy framework that can handle everyday stresses, minor bumps, or falls. But in osteoporosis, the microarchitecture of the bone deteriorates, creating tiny cracks and reducing the connectivity between the bone's internal structures. Because of these changes, even minor incidents like slipping, tripping, or falling from standing height can cause a fracture. These are called pathological fractures because they happen through bone that is weakened by disease rather than by a significant injury. The most common sites for these fractures are the vertebrae in the spine, the hips, the wrists, and the ribs. Vertebral fractures can occur without any obvious injury, sometimes just from bending or twisting movements. Hip fractures often happen after a fall, especially in older adults, and wrist fractures usually happen when someone tries to catch themselves during a fall. The reason these fractures happen so easily is that the disease creates structural defects in the bones. Microcracks develop and the connections within the spongy bone weaken, making the bones less able to resist normal forces. This means that everyday activities or minor accidents can cause a break, which would not happen in healthy bones. Managing these fractures involves not only treating the injury but also addressing the underlying osteoporosis. This helps prevent future fractures by strengthening the bones and reducing further loss of bone density. In summary, pathological fractures in osteoporosis happen because the disease makes bones fragile and less capable of handling normal stresses. The loss of bone density and deterioration of bone structure mean that even small impacts can lead to fractures. It's important to work with healthcare professionals to manage osteoporosis effectively, aiming to keep bones as strong as possible and prevent these painful and often serious fractures. Always consult a healthcare provider for personalized advice and treatment options.